and not necessarily those of this station, its staff, management, or sponsors.
Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia. Good morning. It's always a good morning when you come in. You're pretty. No, but you have your beautiful green tie on, so
Yes,
it's okay.
Yeah.
It's not even St. Patrick's Day.
Well, let me remind our listeners that the flu season this year is horrible, and I'm so proud of my staff and my center because thus far we have not had one hospital admission. We have kept an open door for anyone that feel that they are coming down with anything. And my advice to people, the sooner you come in, the better for you. Don't let this thing run because a lot of people are ending up in intensive care with bronchopneumonia. And there's a lot of advertisement out there for people to take medication and do things, but it's all over the news. I was watching CNN, ABC, all over in the news talking about the complication of the flu this year.
Yeah, I'm hearing it from everywhere in the country. It isn't just here, locally.
And it's horrible. I mean, the
Yeah.
way patients are describing it, they feel like if somebody have injected their thigh with lead. And, it's hard for them to walk. People are basically, one of my dental staff who almost passed out yesterday. We had to sit him down and give him water and then send him home after he got better.
Okay, hot chicken soup. Sorry.
Oh, the
Hot
Jewish
tea.
penicillin. Jewish penicillin.
We got to do that. Okay, but Dr. Mencia, and then since you brought it up,
So
I'll
we
just
still
say
have the flu.
about
We still
Bill.
have the
Wait
flu
a second.
shots.
We got to talk about that. So talk about prevention. When you go to Dr. Mencia, he really watches over you because my husband had a cough. It wasn't going away, and he is 91, and so Dr. Mencia said, listen, it's going to be the holiday. I want to have a nurse come just check him for the next 4 days. I said, what do you mean a nurse? I'm there. He said, no, I want a real nurse to come, which you arranged. Bill is so fine and perfect. Nothing ever bad happened to him. And yet I know a lot of other people going to the hospital. Mm-hmm. So I thank you.
The thing to keep in mind is when the flu season comes any year, at any time, the worst will be for the younger and the very old. So people over the age of 80 and people under 1 year old.
So let me make an example. Let me
But
tell you.
some of the people that have died this year had been teenagers. We have a few teenager people in their 20. A young girl in her 20, I think she was 22. She died with bronchopneumonia.
Okay, so this is what I want everyone to do.
It's affecting everybody.
Saturdays, Dr. Mencia's office is open, Fort Lauderdale. Call this number, get an appointment, get in there. If you have a cold at all, don't wait. This
Just go
isn't
and get
simple.
checked.
954-489-1345. 954-489-1345. If you are homebound, he can help you with that too. It's the AGI Medical and Dental Centers. Although they have a wonderful new Boynton Beach office, they're not open on Saturday, so do that. Now,
for the patients that are established with the practice, we have a fast track where if you cannot get through the phone, you just walk in. I have the flu. They'll put you right through the fast track to get you out of there.
You always do.
So you don't infect anybody.
You're very good at that.
Yeah.
Well,
and if the person cannot make it to the office because they are kind of old and what have you, we will do a home visit to make sure that you get taken care of. I just don't want any of you in the hospital if it's not necessary.
Well, I have been privileged this morning. I really have been privileged to talk to someone, Dr. Michael O'Brien, whom you were so kind to bring in, Dr. Mencia, as you always do.
Thanks to the help
you
of
find stars.
Giselle Largo and Robbie Reed. I mean, it took a lot to get this guy here. I have to pull power from Robbie Reed from Texas and Giselle Largo from here, from Florida, and then we got him here, so he's here.
Well,
we anchor him to the chair, so he's staying for half an hour with us.
And you are amazing how you find people who are unique. And I've known a lot of orthopedic surgeons, but here Dr. Michael O'Brien is a fellowship-trained and board-certified orthopedic surgeon specializing in scoliosis.
Scoliosis. And
So-
different scoliosis and many other conditions of the spine. And, Dr. O'Brien, I tell you, I have one of my patients who is a retired nurse, and she listens to the show all the time. She's probably listening. And the last time she came to see me, I was talking to her about you. Because I told her, I have sent her to so many orthopedic and neurologists to see her, and she come back disappointed. She said, I think I know more about my back.
Well, that's often the case. The patients know themselves better than the doctors do.
Right. So I told her, I think I found your match. So I'm so happy you're here, Dr. O'Brien. Thank you
Thanks for
Well,
having
he's
me.
really a carpenter at heart, which I love to
Isn't
hear
that
about his
beautiful?
history. That was a beautiful story you told us. I always like to ask doctors how they got in their field, but it sounds like you love what you do and you specialize in scoliosis. Why did you first tell the audience exactly what that is?
Well, scoliosis is, it's not a disease. People use the word as though it's a disease. Really, it's just a description. And it just means that when you look at the spine from the front, instead of being straight up and down, there's a curvature one way or the other. There's lots of etiologies or causes for scoliosis, but in the adult population, it's generally what we call degenerative scoliosis. So as the discs degenerate, instead of the spine just collapsing from top to bottom, it'll actually shift off to the side.
And what does that, so can we see that? I know, Dr. Mencia, I asked you when we first started, can you see that in your patients?
Scoliosis can be so severe that you can see as a patient walk, you can see the deformity on the back. And the person will tell you, because when they look at themselves in the mirror, they see the difference between the two shoulders. And when they put the clothes on, the pants doesn't balance like before. So they notice the difference when they dress themselves up.
But Dr. O'Brien, you did say that some people may have scoliosis and not be in pain.
Oh, absolutely. It's symptoms that don't always go along with the radiographic findings. And we've known that for years. There's a very good study out there where the only indication for getting into the study is that you never, ever had back pain. And if you take 100 people who have no back pain, never had any treatment, and you do CAT scans and MRIs, you'll find all kinds of pathologic abnormalities, but they're asymptomatic. So really in adults, we're not treating the shape of the spine, we're treating patients' symptoms. And generally, if people have symptomatic scoliosis, they're either going to have back pain or they're going to get a nerve pinch, and then they'll have pain in the leg. And both of those are very common.
And also it's important to tell the audience that when you have scoliosis and you just neglect it, they say it's pain and I'm just going to take pain medication, and they won't see a specialist like you. They have to understand what are the other complications of scoliosis, like digestion of the food and problem with their breathing, shortness of breath. Because when you have scoliosis, I suppose the spine then is shrinking on you.
Correct.
And then all those organs, they have no room to move. So
Yeah, it's probably one of the biggest associated irritations, if you will, with scoliosis is that as the spine collapses, the diaphragm gets pushed up into the chest, and it's hard for people to expand their lungs. The other thing that happens, too, is actually the ribs can come down far enough that they rest on the pelvis, and people can get a lot of pain from that. But for the most part, scoliosis is not a systemic disease. It doesn't affect the heart or the lungs directly. It's more of a mechanical complication that causes things to be problematic.
And I have, I recall one patient, the scoliosis was so bad that she ended up basically being wheelchair bound. And the esophagus, which is the pipe that connects your mouth to the stomach, was basically in an S form or so. So it was very hard for this person to eat, and she would have a few bites and then raise both of her arms to try to get
swallow.
the esophagus to let the
Correct.
food go down. So it can be a horrible mechanical problem. It can really affect quality of life.
And it's not just scoliosis. Scoliosis is probably one of the more commonly recognized names, but kyphosis, which is a curve in the spine when you look at the spine from the side, can have the same effect as far as swallowing, because sometimes people's chin or their head will fall forward on their chest and they can't lift their head up enough to swallow. And so there can be a lot of mechanical complications associated with some sort of abnormality or deformity of the spine.
Something that Dr. O'Brien said, that it's more common in women. What's the reason for that? Because we can have babies?
I don't know. It's bad luck, I guess. But actually, a lot of forms of scoliosis are more common in women. The scoliosis that people are probably more familiar with is scoliosis in adolescents or children. And that also is more common or symptomatic idiopathic scoliosis is more common in females through the teenage years. But it's about equally distributed between boys and girls for small scoliosis. But for symptomatic scoliosis that needs surgery, it's more common in women. And in the adult population, as people get into their 50s, 60s, 70s, as the discs wear out, it seems that women are more prone to having the disc collapse asymmetrically and result in a scoliosis.
I know when I get a lot of patients with cervical radiculopathy, the pain radiating from the neck, sometimes it's environmental. If I remember before the headphone came out, for the operator, they used to take the phone and hold it in the
On their shoulder.
On their shoulder, and they will. How about scoliosis? Any environmental work-related?
Probably not specifically. I think certainly degenerative scoliosis could occur over time if you were doing some specific motions or movements that made the disc wear out in a particular direction. But I don't think there's really any external forces that will definitely create scoliosis.
Okay.
So is massage good? I mean, I have a massage regularly.
I love massage.
I do too, but does that help? Doesn't it help your body keep straight?
Not really, but what it does, is it takes away the muscle spasms that sometimes can be associated with asymmetry of the skeleton. And so, all the things that we do to treat people or make them feel better when they've got some sort of an orthopedic problem, whether it's scoliosis or anything, is really to take away the symptoms. Sometimes, though, it's not sufficient to just take away the symptoms. You really have to get to the root of the problem and fix it. And, that's when surgery comes in.
So, Dr. Mencia, if someone wants to talk to Dr. O'Brien, they can call your office.
They can call my office.
Or we can give his number so they can call directly. But I always suggest that you always have the orchestra leader, which is Dr. Mencia, and then he watches over things that are happening because you might have some other problems too. So I'm going to give you Dr. Dr. O'Brien's phone number, but I am very strong about having Dr. Mencia always involved. But
the thing is also because the show, we get people from Germany, people that contact us when they listen to the show via the internet. Dr. O'Brien has a scoliosis center that is also in 2 states, so I think we should give the website.
Yeah, okay. The website's better than the toll-free number.
Both of them, I guess.
Okay, well, let's just give all right. It would be, that's right, it's Texas, so it's the Baylor Scoliosis Center.com. The Baylor Scoliosis, you don't know how to spell it, look it up on Google. The Baylor Scoliosis Center.com. And then if you want the number, it's 888-781-5558. But I do think that, Dr. Mencia, of course, brings in brilliant people. Everyone he has brought in, I would say most of the time, have been very attractive and very smart. I don't know how you find these people. You stand on the street corner?
Well, I went to Las Vegas and I saw Dr. O'Brien there dancing. I said, "Why don't you come with me? Let's go to Florida and start business."
Didn't scare you away?
Well, of course, you do have a history of being here in Florida at the Children's Hospital.
Correct.
What's it called? The Children's
Miami Children's Hospital,
which is excellent. So you're really finding people here and finding
and
them
the
in
beauty
Texas.
with Dr. O'Brien basically is so much experience. It's not only he has a rare specialty, but he has all this year of experience. and it's the type of person that think outside the box.
He's friendly. He's sweet. He's nice. I got that feeling.
And he will sit down with you and he will talk to you and trying to understand, where is it that you want to go. So he can, with his expertise, he try to get you there.
Yeah, the surgery that we do is really just part of what we do. Most of what we do is education because I probably only 10% of the people that I see actually need surgery. But the rest of them do need something.
Like what?
Oh, sometimes they need physical therapy, they need pain management, maybe they just need a little medication. There's many, many options on how to treat people. Surgery is just the end of the road. But sometimes people do have a deformity that's really not that symptomatic, but they're terrified that they're going to turn into Quasimodo or something horrible is going to happen as they get older in life. And it's fun to educate people about, what they've got. And the nice thing about our center is that both my partner and I, Dr. Hostin, we see all ages. It's very common, even in scoliosis, that doctors will only do children or they'll only do, adults a certain age. They won't do people over 50. We see the whole gamut of spinal pathology. So we take care of very, very young kids, like 1 year old, all the way up to mid-80s.
Now, when it comes to physical therapy, I know that sometimes the patient come to me and they tell me that, I went to physical therapy and they put me on a traction table when they start. Is that good?
All those we call those modalities. When something's being done to you, that's a modality. So things like traction, deep tissue massage, dry needling. There's many, many ways to stimulate, relax, or strengthen muscles, and that's always the first line of.
But people can
treatment.
get hurt with traction.
Of course,
it's not done right.
Of course, but you can get hurt with anything that's not done correctly, and that's why you really need to find a very creative physical therapist, and that's not always easy. It's like, a good car mechanic, a good spine mechanic, a good therapist,
good carpenter.
It's hard to find good people, and that's most of, one of the best parts of my job, or the most important parts of my job, is finding people around me, medical providers that are good at what they do, to help us keep people out of surgery. But, if they need surgery, we can take care of that.
And also right after surgery, there's a period of recuperation. That
absolutely.
You need that part of your team.
Before you can have sex.
Before you, yeah.
Sorry.
One of my patients told me, the whole show went by, you guys didn't talk about
I
sex.
knew that. I had to say that's right. That's right, because, but, it's interesting how when people have heart surgery, that's the thing they're afraid of most. I went to something called, let's see, I forget what the name of it is now. I went when everybody had heart surgery, and that was the big question. Well, sex. I'm afraid to have any sex because maybe something's going to happen to my heart. And I would be sure with scoliosis. You have some spine surgery, you're really scared. You don't know if you're on the bottom, on the top. You don't know what to do, right?
Doesn't matter. You can be in whatever position you want to be in.
That's right.
You started that. You said that I wasn't going to do that. But my guest, I just want to know, of course, Dr. Andy Mencia, but this is Dr. Michael O'Brien. And I'll just say that he's a fellowship-trained and board-certified orthopedic surgeon. He specializes in diagnosis and treatment of spinal disorders and deformities, including scoliosis and reconstructive spine surgery for children, adolescents, and adults. And he's from New York, Brooklyn. Mm-hmm. He's from New York, and of course, he's now down here in Dallas and here in South Florida. And Dr. Mencia, you are very thrilled to have someone that you can refer like
Absolutely,
that. I know.
because I know you have two centers in Texas. Right?
Correct.
And the one in West Palm Beach.
Correct.
It's 4600 Linton Boulevard, Suite 250 in Delray Beach, Florida.
And you appreciate beautiful women. Giselle is this gorgeous woman
Yes.
you brought with her. She is
I know Giselle for years.
Giselle.
Yeah,
you
Giselle.
always do know all the women, I have to say. But it is very
She's
important.
on my speed dial.
Oh, she's. Well, I want everyone to know, though, also, I just want to go back to the AGI Medical and Dental Centers. They are open, the beautiful new office in Boynton Beach. You can call them at 270-6494, but they're the one that's open on Saturdays all day. He's not opening on Sundays yet, but people are begging him. It's 954-489-1345. He's over there on East Commercial Boulevard, right next to Holy Cross Hospital. And, the one thing that when you were talking about the scoliosis, and it's very important to know that what you said, it's not always surgery. That's the last. There are other things, so they need to go and get themselves checked out first by somebody that's not anxious to do surgery. I love when you said that.
Yeah, I think that's one of my biggest frustrations. We do a lot of what we call revision surgery. So there have been many, many unfortunate people out there who have gone to somebody with some back pain or a little leg pain, and they're in surgery the next day, not literally, but much too fast to have gotten to the operating room. My wife is a physical therapist, and it's amazing to me how many times I really think that somebody's going to need surgery. I just believe they're going to need surgery, but I send them to her anyway, and she makes people better a lot. And it's a very common mistake that surgeons make, I think, in general, but particular spine surgeons, is not to give people enough time to get better with alternative therapies. Right. And again, it's an art, and it's hard. It's hard sometimes for people to, in our society, to realize that it's going to take a couple of months of therapy to avoid surgery. And it's something that I think we need to go back to, because there are many, many surgeries that should never have been, performed to start with. And then we get these people after they've had 4, 5, 6 surgeries, and we have to kind of fix things as best we can. So I think, the non-operative route for these patients is really the initial treatment plan.
It's amazing when we look at the literature on scoliosis. There's a lot of people with scoliosis, 2/3 of the population, according to your data.
There's probably 2 to 3% of the population will have some kind of scoliosis, but
when you look at worldwide,
it's 7 to 12 million people. But if you think about degenerative disease in the knees or the hips, I mean, it's just part of as we get older, we kind of wear out and parts start breaking down.
If someone falls and they hit their spine,
mm-hmm.
And they don't need surgery or anything, and then could that start scoliosis?
Probably one injury like that would not cause a scoliosis, but certainly multiple injuries can start damaging discs. And as the discs collapse, sometimes the spine will shift one way or the other, and then gravity can take over and just kind of keep pulling the spine in the wrong direction.
But Dr. O'Brien, nowadays, I know in your specialty, when somebody fall and do break one of the vertebrae, you can go in there with kyphoplasty or vertebroplasty and reopen the bone again.
Correct. I don't do a lot of that because I don't see a huge population of people with acute fractures. But I think, unfortunately, that's also a technique or a technology that's sort of been overused.
Okay.
It used to be before kyphoplasty that the treatment for a painful compression fracture was just give it time, like a broken rib. Just give it time and it'll heal. Mm-hmm. The problem with compression fractures like that in people who are very osteopenic, they can develop multiple compression fractures which usually don't result in a scoliosis, but they can result in a kyphosis, so people falling forward.
Well, Dr. Mencia, you did it again. You bring these great people on, and now people will know that. Well, the nice thing is they can call you, and then you can figure out how you can get in touch with Giselle, and then with Dr. O'Brien, because this is a wonderful thing to have happen. I hate to think that your patients have scoliosis. But
and for people that, even if they want to go to Texas or people in Texas, I have direct contact with Robbie Reed also, who can make arrangement there. So, if you want to see a specialist of his caliber, call my center, or you can go into their website and view their website at the BaylorScoliosis.com.
Well, maybe this is a very good article to write
Absolutely.
for February, because it's a subject we've not discussed.
Absolutely.
So I think that's great. Well, thank you for being here.
Oh, thank you very much
And
for having
we're
me.
going to take a short break, and then we're going to
Come
have
and get your flu shot.
go get your flu
It's
shot.
your
Right.
time. It's your
Yep,
time.
absolutely. And just stay with us because we have another orthopedic surgeon coming on, Dr. William Leone, but he is
A good friend of mine.
Yeah, I know he is.
Yeah.
You're so excited to go see him again. But that's hips and knees. So that's Mr. Hips and Knees. So anyway.
Same caliber as Dr.
Oh, absolutely. I can attest to that. So we'll be right back. Just stay with us. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.